So a typical workday for me is about 11 hours long. So what do I take in my bag every single day as my work essentials? First thing, probably the most important, is a lunch box. If I'm able to get a 30-minute lunch every day because of the patient load that we have that day, then I'm going to need some food. I'm going to need something to get me through the first half of the day because my stomach is rumbling, and enough to get me through the second half of the day. So I keep that lunch box filled with snacks, filled like with a small lunch, a sandwich, whatever that may be, if I've got the time to sit down and eat. My second is my ID. I need this everywhere I go in order to identify myself as who I am in the hospital, in order to get into the office, in order to get into the building itself, in order to get into certain rooms that I'm going to need throughout the day. Definitely need this on me at all times because it is a lifesaver for a lot of the situations that I'm going to be seeing every single day. Next are two different sets of safety scissors. The first one is a smaller metal one. The second one is a larger one with a little clip that I can put on my waistband. I can put it on one of my pockets, on pants pocket, zipper, whatever that may be, so it attaches to me in order to make sure that I have this on me at all times so I don't lose it. It helps cut off casts. They both help cut off the AquaCast lining, that waterproof lining that we put inside of casts. It helps cut off splints if the people come in with a splint and they're transitioning into a cast. It's got these safety guards that we always tell the kids, it's not gonna hurt, it's not gonna cut. You're just gonna feel that metal rubbing up against you. Both of these are lifesavers because some of the rooms have them, some of the rooms don't, and you never know which room you're going into, if it's gonna have some scissors or not. So you always need both of these on you for the smaller kids and for the larger kids. Next is a notebook and a pen. I need this on me pretty much at all times, whether I'm taking notes for something that I haven't seen before, trying to learn something new for a new patient that comes in, or I just need it for something else not entirely related to either of those. I need the pen on me for all times because also when we are doing stocking at the end of the day, if we are out of anything, I need to write notes to make sure that we have enough coming in either the next day or that following week so we don't have a shortage of any of the materials that we need, such as the colors for the cast, such as the waterproof, the non-waterproof, and stuff like that, so we have enough for the patients that we're going to be seeing. Or in another case, if you can see it, I'm currently studying to be a Spanish medical interpreter, and so what I'm doing is taking notes for all of the words that I'm going to be using every single day in the office, and some of the words that I won't be using as commonly, but might still need them in the office. A lot of the stuff I already know, but some of the stuff I don't know, I'm going to be keeping in here just so I can study it as I come across it, realizing when I'm checking a patient in and there's a word that I wouldn't know in Spanish, I write that down, find it on a medical terminology list, translate it, write it down, make sure I have it for the next time I need it. Next are two things that I actually got in my training. During orientation, I got an in-pass kit review and a clinical team member ambulatory review. Both of these things have like 30 to 40 pages of a bunch of stuff that I might need. If I have any questions that come up throughout the entire day, I can pretty much look them up in here and they will have the answer. Otherwise, I can just ask another team member, ask somebody above me in that totem pole list of hierarchy in the hospital. And most of the time they'll know, but obviously if I don't want to bother them or they're busy, I look it up in here. The list of examples in the table of contents is the introduction, the logging in and logging out, doing a multi-provider schedule, reviewing the patient chart. There are 68 total pages in here. It's got literally everything you could ever need. And so if I ever have any questions, I'll look up based on the table of contents and I'll find the answer I need. And the last thing, and arguably the most important, is a change of clothes. When it comes to an 11-hour shift, starting at 7 a.m., getting out at like 6 p.m., it's going to be really important that I have a change of clothes in case I'm going anywhere, in case I'm spending the night somewhere else, in case I just don't want to come back and I've got something else to go to initially right after work. It's important to have a change of clothes so I'm not going somewhere in my scrubs, such as dinner or an event, going out being social in my scrubs. Kind of looks tacky, so it's always nice to have a change of clothes, something that I can wear instead of my 11-hour-old scrubs that I might have worn the day before. Other than those few things, that's pretty much it. This is what I carry with me every single day. I might add an energy drink or two so I don't have to buy one in the hospital. Sometimes I'll transfer out this lunchbox and I'll buy something in the hospital cafeteria instead. But other than that, pretty much all of those things I've got on me every single day in case I need them at any point throughout the day. And that's pretty much all I got. So other than that, if you did enjoy, drop a like on the video and subscribe to the channel so you don't miss out on any future content I have coming, and I will see you all in the next one. Peace.